ladies and gentlemen, I welcome you back again to my channel. This is your friend and brother, ODoctor. If you are joining us for the first time, this is your favorite YouTube channel where we promote health in the language that you will understand without medical terminologies. If you are a returning subscriber, thank you for your kind patronage. If you have not subscribed, please remember to subscribe and inform your friends. Thank you. Today we shall be talking about Postinor 2. Yes, Postinor 2. Something happened. A young lady presented, and in the course of our discussion, she presented on account of infertility. She's looking for a baby for the past 7 years. So in the course of our talking, she said she has been using Postinor 2 for the past, 4 years or so. Like she has been using it consistently. Anytime she goes intimate, she normally takes Postinor 2 to prevent pregnancy. So that necessitated this video because I know there are several people in that kind of a scenario. So we need to talk about it so that we run with the right knowledge. So what is Postinor 2? It is a medication that is used to prevent pregnancy. Yes. Any medication used to prevent pregnancy is called a contraceptive. Postinor 2 is one of them. However, Postinor 2 is a special contraceptive in the sense that it is an emergency contraceptive. That's the key word. It's an emergency contraceptive. It is used only on emergency basis when your normal, regular means of contraception has failed you. That is when you use Postinor 2. How do you take Postinor 2? You take it with water. It usually comes as tablet, single tablet or double. Okay, if it comes as 2 tablets, you take one now and take the other one 12 hours after. And you must take it very as early as possible to the intercourse. Okay, the more you delay it, the less likely that it would work. So it is advised you take it within 72 hours of the intercourse so that it works. Okay. If taken within the first 12 to 24 hours, the success rate is almost 85%. So it's advised you take it as early as possible for it to, have a good outcome. All right. So how does it work? Postinor 2 is a hormone. It just contains hormones. So it works by one, preventing ovulation. All right, ovulation means the release of egg from the ovum. So if you have not ovulated, Postinor 2 helps to prevent the ovulation. If you have already ovulated, and for example, if fertilization has taken place, Postinor 2 can also help to prevent implantation. What is implantation? It is the attachment of the baby onto the uterus, okay, onto the womb, so that if fertilization has already taken place, it won't implant, and pregnancy, of course, won't occur. Those are the two major ways that Postinor 2 works. All right, and are there side effects of Postinor 2? Yes, those most of them are not pronounced. Common side effects include nausea. Nausea is like having the feeling to vomit, vomiting, breast tenderness, bleeding. You can have vaginal bleeding, but the most important side effect is altered menses. Okay, your period might get elongated, it might get shortened, might bleed more, might bleed less. So you must most likely experience any of this, especially the altered menses. Okay, so just in case maybe after taking Postinor 2 you don't see your period for the next 1 month or 2 months, or you don't understand it again, you don't need to worry because it's as a result of the drug you have taken. And then what's the final message here? What's the take-home message? The take-home message is it is an emergency contraceptive, and we do not expect you to be having emergencies every day, right? Okay, so it's not something that you should be doing just like what I've told you. Somebody has been taking Postinor 2 for the past 4 years consistently, and the consequences is why she presented to the hospital, which necessitated this video. Just like I have always believed, it is better you learn from the mistake of others instead of you learning from your own mistake. Experience is not a good teacher, even though it is the best teacher. All right, do not allow to learn from your own experience. Take a cue from others and do not repeat their mistakes. Postinor 2 is not your regular paracetamol. That's the take home message. It is not your daily vitamin C. It is not your daily multivit that you chew like what I drink anyhow. Please, you don't just take it because there are other means, natural and artificial means of contraception that you can be doing every day that is safe. Postinor 2 is not one of them. So you only reserve it on emergency days, which you should, as much as possible, try to avoid. All right, so that's the importance of this message, and I believe I have made an impact. If you believe so, please kindly help me to also deliver and pass across. I've informed you, but I have not informed your friends, and you can facilitate that by hitting the share button so that they will also have a glimpse of what we're talking about. You can also subscribe and also like this video. It helps YouTube algorithm to rate the video high. I remain your friend and brother ODoctor. Thank you for banking with us, and thank you for watching our videos, and see you in my next video tomorrow. I really love you. Take care of yourself. Bye.